My name is Alan Dury. I'm head of medical affairs for Cosette Pharmaceuticals. We're fairly new in the epilepsy world. We're fairly new in the LGS world. I'd like to echo Dr. Chapman's comment. The stories we've been hearing over the past couple of days have been eye-opening. The resilience of this group is absolutely incredible. We're excited to be supporting you, and we're going to do our best to do just that. So with that being said, I am going to talk to you this morning about a product called Sympazan, which is a different formulation for clobazam. But before I get there, I'm going to start by presenting to you some results of a survey that was conducted a few years back. So that survey was conducted amongst caregivers of children with epilepsy. About half of them were LGS caregivers. Some of you might even have participated to this survey. The objective of the survey was to basically assess the administration experience with anti-epilepsy drugs from your perspective, from the perspective of the caregivers. We also wanted to identify the frequency of medication non-adherence. So that means when a full dose is not administered or just completely skipped, and what kind of consequences that had on your child. So one of the first things that was asked is whether it ever happened that your child spat out their medication. And about 70% of the LGS caregivers that we talked to responded that yes, it ever happened. Or also whether they refused flat out to take their medication at some point, and it has led to completely skipping a dose. So about 2/3 responded that yes, it happened, that they refused to take a medication. We also asked whether it ever happened that medication was spilled, and half of you responded that it happened before, or whether medication was dropped before, or if you got distracted while preparing medication, and you would have to start all over again, basically. And so what does that do? Well, that leads to about 2/3 of you responding that you've probably at some point administered less than a full dose of medication to a patient that really needs that medication. And this has consequences. These drugs are important to manage the condition, and in 74% of the case, caregivers reported that this led to a change in the severity or the frequency of the seizures. So about half of you responded that this would lead to experiencing a greater number of seizures overall, or that seizures would be more severe. And here comes Sympazan, a product that we recently acquired as a company and that we're very excited to support. So it is an anti-epilepsy drug. It's based on clobazam that you are probably very familiar with as a drug. And it's indicated for the seizures associated with LGS in patients as young as 2 years old. So it presents as a strip. You can think about like Listerine strips. So it's berry flavored. So you put it in the mouth as a whole. It sticks. It dissolves pretty quickly within a few seconds, and you're sure it delivers the full dose of medication. It's available in 3 different strengths, 5 milligram, 10 milligram, and 20 milligram to fit the prescription of your provider to deliver the appropriate dose. In your bags for the conference, you've all received this pamphlet. So it provides information on the product. You will see that there's no need for food or water to take the strip of medication. So it is keto-friendly for the patients that are on a keto diet. And I would like to direct your attention to the back pocket at the end of this pamphlet. So if you just turn it around, there is a strip it's a demo strip, so it doesn't have any active ingredient in it. It's just for you to get a feel and a taste of what that strip looks like. So if you open the packet, you will see inside of it, you have a demo strip. It tastes exactly like the real product, so it dissolves very quickly. You just put it in the tongue and it's gone. So you can see for yourself what the taste is like. You can have your child try it and see if they like it. Again, there's no medication in it. We have more at the booth as well if you would like to come by and ask questions to my colleagues. You can also find some information on our website on the medication, and you will find some support there. Obviously, just like clobazam, Sympazan carries the same risks, the same kind of adverse events that you would see with that drug. It's a benzodiazepine, so it comes with all the risks of these drugs. It shouldn't be mixed with opioids. If there's an allergy to clobazam, it shouldn't be taken. And your healthcare providers should know about all of the conditions and the medications that your child is taking. It's very important for them to have a full picture. And this is it. Hopefully, we've caught up a bit of time. So we do have the young family here that we've been very lucky to learn from, to hear their experience over the years. And we're very lucky to have collaborated with them in the past on this. Thank you, everyone, for your time. Thank you.